Good evening, ladies and gentlemen. Welcome to the inaugural ceremony of Heart Failure Association of India annual conference, the HFAI Virtual 2021. To start the proceedings, I invite Dr. Abraham Umman, the organizing secretary, to say the welcome address.
Thank you, Dr. Hari. It's with a humble heart I am speaking to you because more than 2,500 people logged in 45 minutes prior to the meeting. And that is gratifying and it's humbling because we know the interest of people in heart failure. In this meeting, we are trying to address multiple levels of needs from the primary care physician level to secondary care to in-hospital care to transplant and total artificial heart. I would like to thank and welcome Dr. Andrew Coates and all the faculty from ESC and other international faculty and all the speakers. I do not want to take much time. And the most important thing is the scientific aspect of it. And the proof of the pudding is eating it. Let's have an academic feast. And with that very short welcome address, I close and I request Hari Krishnan to continue.
Thank you, Dr. Abraham Umman, for that short and sweet welcome. Now I invite Dr. Andrew Coates, who is the president of the Heart Failure Association of the ESC, to inaugurate the conference and do the welcome address. Professor Coates, please.
Thank you very much, Dr. Hari Krishnan, Dr. Oman. It's my great pleasure to be here representing the Heart Failure Association of the European Society of Cardiology at your now 7th meeting of the Heart Failure Association of India. I understand you have a proud history starting in 2014, and this meeting's in concert with the Society of Heart Failure and Transplantation and the Indian Society of Heart and Lung Transplantation. I'm very impressed with the large number of registrations you have, and I know you normally have between 500 and 1,000 attendees, but we've just heard you well exceeding that with a number of people logged on to this virtual meeting. We do all look forward to when we can actually meet in person. My last overseas trip came through India on the way to Europe, and it's been about 12 months since we've been able to fly, so that's a very sad event. I've already participated in a prize series of presentations, very impressed with the quality of presentations, and it's my great pleasure to continue a long association between the Heart Failure Association of Europe and the Heart Failure Association of India, and that goes along with multiple joint sessions in our European meetings as well as meetings here in India, and we're extending that association now with endorsement of the physician and nurse training programs session starting in March this year of the Heart Failure Association of India, and it's a very proud moment for us to say that we're very keen on seeing this development and further expansion in our joint educational collaboration. So to formally start this meeting, I'm very impressed with the organization and looking forward to the later sessions. Thank you very much.
Thank you, Dr.
Shubham kurutvam kalyanam arogyam dhanasampadah. Shubham kurutvam kalyanam arogyam dhanasampadah. Shatru buddhi vinashaya deepajyotir namostute. Deepajyotir namostute. Shubham kurutvam kalyanam arogyam dhanasampadah.
Now we will have the release of the heart failure manual. The heart failure manual is a work of the group of cardiologists from the Heart Failure Association and also the National Heart Failure Registry group. So we have a collection of 80 chapters where we emphasize on the guideline directed management of heart failure. Probably, I hope this will help the physicians to provide more evidence-based therapy to patients and improve the outcomes. I request Professor Andrew Coates to formally release the book. Few words from you, Dr. Coates.
Yes, thank you, Dr. Hari. It's my great pleasure to launch this book. My close colleague, Dr. Professor Stefanica, was going to do that, but he's been called away to a meeting in Brussels. But it's my great pleasure to step in the place and launch this very important book, 450 pages, packed full of expert advice on a manual for heart failure management, looking at the most up-to-date guideline-directed medical therapy, and that's been contributed by many members of the Heart Failure Association of India and investigators of the National Heart Failure Registry. Published by J.P. Brothers, I'm sure that this manual will be an extremely valuable resource for everyone interested in heart failure and wishing to learn more about the management of heart failure. And now that we're going through the period with the most exciting developments in the field of heart failure, it's a very important time to take stock of what we know we can do, because that is the foundation on which we will continue to improve our management. So my congratulations for an excellent book, and I'm take great pleasure in launching that today.
Thank you, Dr. Coates. Now we will have another release of the heart failure yearbook. So every year we publish the latest developments which happened in the previous year, and it was the second edition of the book. Dr. V.K. Chopra, who was the past president of the Heart Failure Association of India and currently the chairman of the Heart Failure Council of the CSI, is editing the book. And now I invite Dr. P.P. Mohanan, the president of the Cardiological Society of India, to release the book and felicitate this meeting. Dr. Mohanan, please.
Thank you, Hari. Mr. Coates, Dr. Chopra, Dr. Umman, and other HFI office bearers. It's my proud privilege to release the heart failure manual. And we have nearly controlled COVID pandemic. But then the pandemic of heart failure is still at large. And the year 2000, Professor Bornwald wrote in Circulation that, and he was wondering about the seeming paradox that while we were able to control every form of heart disease which leads to heart failure, the heart failure cases and mortality is increasing. Possibly, whatever we are doing in our improved survival with the use in the clinical trials and various other is not reaching possibly the clinical practitioners, and HFAI is in the forefront to educate our physicians and cardiologists in the guideline-directed medical management of heart failure, and that is the way to go. I wish HFAI 3-day meeting every success. Thank you.
Thank you, Dr. Mohan. Thank you, Dr. Mohanan, for that words. Now we have another release. Heart Failure Association of India is coming out with a monthly newsletter called Heart Failure Rewind. It is between a magazine and a journal, so some form of light reading with whatever developments happening in the previous weeks. That is the idea. A group of young people are behind that. Thanks to all of them. It will be given in print and distributed to the members of the society and the cardiology community in the country. That is the idea. It will be around 35-40 pages, small booklet like thing. So I invite Dr. V.K. Chopra, the chairman of the Heart Failure council, Heart Failure Council of the CSA, and also the man behind Heart Failure Association. He started this association in 2015. Dr. Chopra, please.
Thank you, Dr. Hari Krishnan. It was nearly 8 years back that we conceived this idea of starting this association. And it is very rewarding to see how much it has grown. I still remember the first year there were just about 100 people attending this meeting. And Dr. Uman tells me a few minutes ago that there are already about 3,500 who have logged in at this relatively early hour. I'm sure this number is going to grow. For this, I think we have to thank a number of people. Dr. Inder Anand, who supported us right in the beginning. Dr. Stephen Anker, who all these years has stood like a rock and has been instrumental in our association with the European Society of Cardiology. Professor Andrew Coates and Dr. Rosano, they have been with us 3 times already, and they always keep encouraging us with whatever participation that we have to do. A critical thing has been, I think, in our growth, a critical thing has been the association with European Society of Cardiology, because right from the first year, the president of ESC, Heart Failure Association, and colleagues participated in our meetings, and they let us have a joint session in their annual meetings, something which continues every year. So I think that has been a key driver in our growth. I must also thank Dr. Hari Krishnan, who in these 2 years has taken the association to new heights with multiple innovative programs which have really taken off and galvanized the heart failure community in our country. And Dr. Abraham Uman and Sundar, who have worked tirelessly to make this meeting a great success. So we look forward to very, very useful deliberations over the next 3 days. Thank you. And now I have great pleasure in releasing the newsletter, which I'm sure will be of great interest for light reading and for information.
Thank you, Dr. Chopra. Now we go on to Dr. Sundar for the vote of thanks. I think Dr. Uman and Dr. Sundar, before he start, I should say that they have done a wonderful job. Anybody who sees the program should feel satisfied of how a program can be developed in a very beautiful and scientific way. Over to Dr. Sundar.
Good evening to you all, to the dignitaries and the learned members in the panel today. I would like to thank you all for your time and your presence and support you've offered. Special thanks to Dr. Chopra, Dr. Hari for giving Dr. Abraham and me an opportunity to organize, and a very special thanks to Dr. Uman, who has pulled off the impossible. He has done a Herculean task in getting out so many registrations. I would like to place on records the thanks to the speakers, the moderators, and last but not the least, the delegates who have come here. Thank you, one and all.
Thank you, Dr. Sundar. Now we come to the end of the inauguration session. We will start the session in another 2-3 minutes. I think we finished early, so we have probably 3 minutes to start. What the plan of the program is, Abraham, can you? Hello? Yeah.
And you go ahead. You can give a curtain raiser.
Yeah, okay. I will start sharing my screen. Can I see my slide?
Yes, sir. Please go ahead.
So this is the prelude to the meeting. So as already said, we have this is the 7th meeting of the Heart Failure Association of India. The meeting started with a curtain raiser, the Heart Failure Conflicts, which was a basic scientists meeting along with the cardiologist. It was very successful and well attended and very well appreciated. This meeting, as already said, it is with the support of the ESC Heart Failure Association. I should thank already these two people who have crafted this program. And we have a very good host of international faculty, including the three giants from ESC, Dr. Coates, Dr. Osano, and Stephen Anger, and the other people there. And thanks to our team. And the program is every day we start the session at 5 o'clock with the adjunct symposium. 3 hours we have the main session, and we end again with an adjunct symposium. And in Hall B and C, we have the surgical program, the transplant program, the rehab, and the nurses program. We got 5 CME credit hours from the Tamil Nadu Medical Council. Make sure that you attend all 3 days program and enter your name correctly as registered to get the certificate. Before I conclude, I should say some of the upcoming programs and ongoing programs of the Heart Failure Association of India. We run a 6 weeks physicians course, and as Professor Coates has announced, the second course we are starting in March 2021. It is supported and endorsed by the Heart Failure Society of the European Society. We do a nurses program that is also going to be endorsed and supported by the ESC. We do monthly seminars like topics on cardio-oncology, peripartum cardiomyopathy, and very important program for the trainees, the postgraduates. We do the heart failure clinics, a monthly clinical training program, which is very well attended and very well appreciated. We also give awards to the best dissertation for the postgraduates, and also we give research funds. We have received a good number of proposals for research funding. These are some of the activities which we do as part of the Heart Failure Association. So welcome to Heart Failure HFAI 2020 virtual. Thank you. Shall we go to the...
Yeah, we can close the session and then go to respective halls for the meeting. We are exactly on time.
Okay.
Thank you very much.
Thank you.
Thank you.
Thank you, everyone.
Thank you, Dr. Coates.
So, so we have exactly about 30 seconds to start the next session, sir.
Yeah. So I am in Hall A now.
Yes,
Yeah,
sir. You
yeah.
and Professor Iyengar are together, sir, as small chairpersons.
Okay. Okay. Yeah. Good evening, Dr. Iyengar.
Good evening, Dr. Harikrishnan.
Yes, sir.
It was an extremely impressive inaugural ceremony. An extremely impressive prelude.
Hello,
Excellent.
Dr. Iyengar.
Good evening, Dr. Vijay. Should we start?
So Anand, give us a countdown. So, sir, the plan is you just start the session, and the pre-recorded, all the talks are pre-recorded. They will run one by one without any break. And then at the end of the session, we will have a discussion of 15 minutes. That is the program. So,
This is a case discussion. So, should I mention few, whatever?
yeah.
Here?
Yeah, sir. Yeah, you mentioned that, and then we will go ahead. Yeah.
Announce the speakers' names and the.
Yeah, yeah. Once you introduce that, we will go to the pre-recorded versions. Yeah.
Right.
Anand, give us a countdown.
Sir, I think we can go ahead, sir.
Yeah. Sir, please.
Yeah. Good evening, ladies and gentlemen. It is a great pleasure to be part of this meeting. And we have a case-based discussion in talks. And the case is a 65 years old male, a diabetic, hypertensive, smoker, and obese, as presented with worsening of breathlessness, and is also on treatment for COPD. And it is my pleasure to co-chair the session with Dr. Harikrishnan, who is president of Heart Failure Association of India, and I am consultant cardiologist from Manipal Hospital, Bangalore, Dr. Iyengar. To the presenters, starts with Dr. Kannan, followed by Dr. Negi, Dr. Sandeep Sethi, and Dr. Karunadas. Dr. Kannan.